It's time to beat the stigma of addiction and mental illness, but what happens after a diagnosis or after friends and relatives find out you need help? Do they ever look at you the same way again? Dr. Rajiv Parinja from Mercy Health joins us this morning with how we can beat the stigma. Good morning. Thanks for being with us today.
Good morning. Thank you for having me.
Absolutely. So how does one deal with being a recovering addict?
You know, being a recovering addict can be difficult. It is a process. The first thing is to recognize that you have an addiction. And very often, the people who have an addiction don't recognize it at first, and they may be family members, colleagues who see signs and might have to, encourage you to seek help. If you recognize that you have an addiction, then you would want to have treatment. It can seem that addiction is quite easy to beat because all you have to do is to stop using the drug. But it is not quite that simple because our brains change with addiction, and it becomes a habit, which means that it becomes automatic. Addiction can be difficult because people judge us and blame us if we have an addiction, and kind of imply that there's something inherently wrong with us, which is not the case. The way we understand addiction today is that it is a disease just like any other, which has an underlying pathology, and it is also very treatable. I think what I tell my patients when they're early on in addiction is that the treatment for addiction requires sustained engagement to have a good outcome.
You know,
we don't want to skimp and say, oh, well, I'm recovered and I'm going to be okay. Just after a short treatment.
Right. It's a lifelong, going forward. And as you mentioned, it is a disease, not a decision. And I think that when we think about that, we can help beat that stigma. But, how do you interact with folks when they know that, you're in recovery? How do family members, how do you begin to interact with people?
So, as an addict, it can be difficult because people don't know and they might be judgmental. If you are in a state where you are recovering, I think it is always worth being a part of a community. There are many programs like 12-step programs where you would see how other people are dealing with their family members and friends. When you are in a state where you're doing well, you may be able to educate them about what addiction is for you and how it has impacted your life. A lot of addicts who have been in sustained recovery actually find meaning and they find some wisdom in the process of recovering. And you may be able to share that with people and educate people about it. Now, if you are the family member who has a loved one who is an addict and you're communicating with them, that can sometimes be a frustrating experience. It can be exhausting, even infuriating at times. And, I encourage people to, again, join groups. There are many available where you would be supported by other family members who've gone through what you've gone through. And the key to communicating with somebody who is dealing with an addiction is to not blame them, is to not invalidate their emotions, is to always come from a compassionate standpoint and to keep the channels of communication open, even when you may not be getting the results that you want very quickly.
Yeah, it's not going to happen overnight. This is, as you mentioned, it's not something that, you could just turn around quickly. So it is a disease, as you said. So where can folks get help? You mentioned support groups and things like that, but, where can they start?
So, if you're just starting out looking for treatment, a good place to start is a website called findtreatment.gov, findtreatment.gov. There is an organization called SAMHSA, SAMHSA, where you can find your local treatment providers for addiction if you put in your zip code. And there's a range of options. There is medication-based intervention for certain kinds of addiction. There are group therapies, individual therapies, and once you make some phone calls, get some appointments, you can get started with the process of treatment. Once you've done with the acute phase, I always encourage people to stay engaged in the community. A lot of addicts will find sponsors, people who have been addicts and have maintained sobriety for a long time, who can be their mentors. And once you have maintained sobriety for a long time, you could become a sponsor and give back to the community. And the evidence shows that engaging in this process greatly improves your chances of maintaining sobriety long term. Both having a sponsor and eventually becoming a sponsor to somebody who's an addict can be helpful.
Some great information this morning on how we can all beat the stigma and be happy and healthy in recovery. Doctor, thank you so much for joining us this morning.
Thank you for having me.
Yeah, take care. You bet. WTOL 11 has partnered with the Ohio Opioid Education Alliance to educate and help beat the stigma surrounding mental health and addiction. If you or someone you know is struggling with mental health addiction, or you want to know about stigmas surrounding them, please visit beatthestigma.org for more information. Your Date is back for a moment.